Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology. Dr. Abraham White is a comprehensive ophthalmologist in Kansas City, Missouri. He received his bachelor's and medical degree from the University of Missouri Kansas City School of Medicine. He completed his internship in general surgery at the University of Pittsburgh Medical Center and his ophthalmology residency at the University of Texas Health Science Center at San Antonio. Dr. White serves as an associate residency program director and is a staff ophthalmologist for the University of Kansas Health System. Dr. White, it is great to have you on the show.
Hey, it's a pleasure to be here. I appreciate the invitation.
We'd love to hear how you first got involved with sports ophthalmology.
Absolutely. So my first introduction to sports medicine in general was fortunately in medical school. So at UMKC, where I went to medical school, we did 2 months of family medicine. 1 month was at the home institution, and then for 1 month, they would send us out for a rural rotation, which I happened to do mine in Warrensburg, Missouri. And the doc that I worked with there was actually the team physician for the college. And so 1 day a week, he would do a sports medicine clinic at the college, and then he would also work with the athletes throughout the week, and then he would travel with the teams. And at the time, I kind of thought to myself, well, I'm not sure I'd want to do family medicine, but if I did, I would definitely want to do it like this. He had a really, really cool relationship with the university and the athletes that were there. And it was just a really, really great experience. So that was my first exposure to sports medicine in general. For sports ophthalmology, I was really just honestly in the right place at the right time. So the other member of our faculty who had been working with the team had left the department for personal reasons. And they approached me and asked, hey, do you want to do this? And I basically, my response was, what kind of a question is that? Of course I want to do this.
Yeah.
So that was really how I got involved with working with athletes as an ophthalmologist.
So just kind of a matter of being in the right space at the right time.
Exactly.
So I'd love to hear a little bit more about what are those responsibilities as a team ophthalmologist?
Sure. So essentially, what we do for the team is we'll do usually in the preseason some examinations for the athletes. So we just do kind of a basic screening exam just to make sure that the vision is normal, the pressures are normal. We're just looking to see, are there any abnormalities here that we need to be aware of? Do we need to do a full exam? Is there anything going on that, we should fix? So, obviously, most of the athletes that we're working with are, extremely healthy. And so the majority of the things that we tend to pick up are going to be things like refractive errors. And so it's just kind of making sure that their glasses and contacts are up to date, or for the folks who are candidates, getting them set up with refractive surgery.
So that's kind of at the beginning of the year. And then do you deal with game coverage as well? What does that look like?
Absolutely. So we are, in the stadium for all the home games, and we actually serve as the coverage for both teams. It's kind of interesting how that works, which fortunately it's pretty rare to have incidents during the game that we need to worry about. Most of what we deal with tends to be off-field stuff. And we're literally providing, the primary eye care for the athletes, and we're pretty much on call for them 24/7. So if the athletic trainers find that, one of the guys has an issue, they have our numbers, and so they know who to reach out to, so that way they can get a hold of us. And it can be, oftentimes even something as routine as, hey, this player's glasses broke, we need to get a replacement as soon as possible, or something along those lines. So oftentimes it's stuff that's that simple.
So are you in the stadium there to respond to those calls, or maybe off stadium, just on call uh, as a consult?
So we are in the stadium
Okay.
for those calls. Just in the odd event that there is something that comes up, either injury or illness or something. That way, we can basically help the athletic trainers and the team to figure out, can this player be returned to the game safely? Because at the end of the day, that disposition is kind of the critical question. When you're dealing with on-field issues, is can they return to play? And so they like to have us close at hand for that. And I've actually got a kit that I bring with me to the games that has a direct ophthalmoscope. I've got some fluorescein, some proparacaine, a couple of bandage contact lenses, a little near card. And I just basically carry that with me to the game, so that way I've got kind of a portable way to be able to do a quick exam on a player if I need to do one.
What are some of those things that would keep them from returning to play?
So, obviously if there's a really severe injury, which I haven't fortunately seen one of these, but theoretically, if a player had like a ruptured globe, they're obviously not going back to the game. They're going directly to the hospital. If they had like an orbit fracture or something like that, they definitely would not return to the game either. And fortunately, we've got access to really good imaging capabilities, both within the stadium and also at the training facility that's pretty close by. So we're able to make those diagnoses pretty quickly. And those would be the two main things that I could think of that you'd likely see that the player probably wouldn't return to the game in those situations.
When you're saying imaging, that's like having a CT scanner available nearby, or like X-ray, or what does that look like?
Yeah, absolutely. We have the ability to get a CT very quickly in the event that there's an injury. So,
Mhm. So what are some, I mean, clearly this is like premium top care giving to athletes. What are some of the advantages that you've seen of having an ophthalmologist on call, being there? Um, yeah, what are some of the positives of giving this excellent care?
so I would say one of the positives is that we do have the ability to provide an exam, on the sidelines if need be, or in the locker room. And that, in many cases, is going to enable us to rule out a more serious injury, so that way we can return a player to the field if need be. So I would say that's the primary benefit of us being there. Also, in the event that there is a severe injury, our hospital is not that far away, and so I can basically make the phone call to say, "Hey, we're hopping into the ambulance now. Have our operating room ready," and so that way we can basically be primed and ready to go if there's something that turns out to be a surgical emergency that we need to deal with. So we've basically got the ability to streamline things for the athletes.
th- is it also sort of like a medical legal consideration, having like an expert ophthalmologist there to be able to make that call if they're returning or not returning, rather than just the family medicine doctor or the athletic trainer making that call?
Well, I mean, in a lot of cases, the athletic trainers or the sports medicine physicians are going to want to get a consultation right away, because oftentimes, they're not as experienced doing the eye exams as we are, and they're also going to be having a harder time picking up on some of the more subtle features on the exam, especially because you're oftentimes doing these not in the most ideal environment. It's a noisy stadium or a locker room where we don't have the normal equipment that we're used to working with. um, it's honestly a little bit more analogous to doing a bedside exam for a hospital consult is probably the best comparison that I can give to it.
Hmm.
um, so there certainly are limitations to even what we can find on those exams. But having us there at least gives them the ability to bring a player back onto the field if it looks like their injury or their issue is not something that's going to be severe or significant.
So switching gears a little bit, you clearly have some experience with football. What are some of the common eye injuries that can occur in the sport of football?
Well, fortunately, football is actually not one of the more common sports that we'll see injuries in, and a lot of that is just because of the protective equipment. The professional leagues' efforts to ward off concussions obviously have been very, very well publicized. And eye injuries, I think, have kind of benefited from that, sort of as a side effect, almost, I guess you could say. That the helmets do a really, really good job of protecting, not just the brain, but also the eyes as well. So you will occasionally see a player that will get like a corneal abrasion or something like that if somebody gets their fingers into the face mask. And certainly, if a helmet comes off during a play, anything goes at that point. Because these guys are moving really, really fast, and it's just mass times velocity squared at that point. So if the helmet comes off, that's when we're a little bit more likely to be needed if there's some sort of an injury in that way. But by and large, the helmets that the players wear do a really good job of protecting, not just the brain but also the eyes as well.
Do you find that those injuries come from underneath like near the chin strap, or through the face mask where a visor would block that contact?
So most of them that I've seen and heard about have been injuries that came, with fingers through the face mask. Uh, Hands or fingers under the chin strap, depending on how the player lands, that can actually be a more common way that the helmet can get dislodged, though. And so indirectly, it can happen either way.
Got it. What are some of the unique aspects of American football that the usual ophthalmologists might not anticipate?
So one thing that I would say is a little bit interesting is that the visual needs of the players really varies a lot depending on their position. And when you compare that to a sport like, say, baseball or hockey, you know, all of those players, regardless of their position, need to have excellent vision and need to have excellent stereo acuity to do what they do. With football, obviously the visual needs of, say, the quarterbacks and the wide receivers are going to be a lot more demanding than, say, the visual needs of the guys that are on the line. And so we'll occasionally, identify a patient that's like, hey, you've got a little bit of a refractive error, and they'll choose not to correct it, just because it's like, well, glasses or contacts would be a little bit of a hassle for me. And as long as I can see the guy I'm blocking, that's all I really feel like I need. Versus, for a lot of the players that are in positions where they're going to need really excellent stereopsis, so that they can, catch a ball like a safety. Somebody who's, either a receiver or somebody that's, trying to go for an interception. Those guys are going to want really, really excellent stereopsis and really excellent, perfect acuity in both eyes.
Yeah, that's something that I hadn't thought about. For I'm used to like basketball, like that's something that everyone wants good vision in. Hockey, you mentioned, baseball, and so that's interesting. That even within the sport, you have to tailor it to the patient's needs.
Yeah, absolutely. And that's one of the cool things about ophthalmology is that, we do really have the ability to tailor what we're doing to the needs of the patient, and in this case, to the needs of the athlete. And so, for some of these guys, they will say, my vision is adequate for what I need to do. And glasses or contacts would not be of benefit to me in what I'm doing. And so that's just sort of a decision that you make, cooperatively with them.
What are some of your favorite parts about being an ophthalmologist working with athletes?
So, I would say honestly, there are a lot of aspects of it that are really satisfying. And I have the privilege that I don't just work with professional athletes. I work with athletes at all levels. And I can remember, honestly, one of my most memorable athletes that I worked with over the course of my career was actually a junior high school athlete who was referred to me for cataracts. And this young athlete, his first concern was, is this going to prevent me from being able to play football? And so one of the things that was a big part of the informed consent discussion with the patient and his family was about, well, here's what your recovery is going to look like, and then we talked quite a bit too about, where do we want to target your vision for? Because obviously in that age group, the eye's not fully developed, it's not fully grown. And so, we got to have the discussion with him about, well, do we want to target you for pure distance now, recognizing that you're probably going to be a little bit nearsighted in a few years? Or do we leave you a little bit hyperopic, recognizing that it's not going to be totally perfect right now, but it's probably going to be a little bit closer later on? And fortunately for him, we were able to get his surgery taken care of. He recovered well, and we got him back to his sport. We were able to time the surgery between his school year and his sports seasons to be able to minimize his downtime. And so, for me, that was a really satisfying experience.
Yeah, I think one of the best things about being a doctor is helping people live the life that they want to live and helping them be happy and pain-free doing that. And so as an ophthalmologist, being able to give them the vision that they need to do what they want to do is a great thing.
Yeah, absolutely. And that at the end of the day is the name of the game, is we're trying to empower our patients to be able to do what they need and want to do in their lives. And, as ophthalmologists, we really have a very powerful ability to do that for our patients in most cases.
So it's been mentioned before on the podcast, something that residents can get involved with right now, or I guess medical students as well, is getting involved with athletes at all levels, like you mentioned, whether it's high school, even junior high school, or different sports as a way of getting some experience in this field before making a leap for maybe the professional level or something like that. What are some of the different aspects of the different levels that you've noticed?
So, for me, I really try to treat all of my patients the same insofar as I'm able. And I've kind of had the discussion before with my patients or with my residents in the operating room that when you're in the operating room, the patient on the table is the most important patient. That's the only patient that matters in that moment. And so you want to kind of avoid all of those other distractions that can happen in the operating room so that way you can focus on that most important patient. And the same thing is kind of true in the clinic as well. So you want to basically make sure that you're giving that patient your full focus, and making sure that they know that, hey, in this moment you are the thing that matters. You and your problem are the thing that matters. And to do that for not just athletes but for patients at every level, I think is really important for patient satisfaction, and also so that your patients know that you really are invested in their outcome at the end of the day. Whether they are a professional athlete or a junior varsity or junior high school athlete or whatever, they know that their needs and their health is important to you. And I think that that's really critical. And to some extent, it kind of goes back to the concept that he who can be trusted in small things can be trusted with great things. And so if you're not able to provide really great care for for the least of these, are you really going to be trustworthy to provide care for celebrities and people who are sort of that society views as being more important and more valuable, I guess, would be kind of a simple way to put that.
How have you seen these people react when you maybe reach out and say, "Hey, how can I help?" Like, what's the first step look like? Is it at an institutional level, or maybe just a personal level? Hey, if you need anything, I'm here.
I would say for me, it's kind of more at a personal level. So, as we're doing the preseason screenings, I'll very commonly, tell the players, it's like, hey, if you have any issues, we're here for you. The athletic trainers have our number. Just feel free to reach out. And one of the challenges for the professional athletes is that most of these guys only get 1 day off a week. And so if they do have some sort of an issue, they're almost always, dealing with that on their day off, which understandably, these guys, they really covet that time. And so, I know that for them to bother me, it's probably not the best term, but for them to reach out to me with an issue, to be dealt with on their day off, it's got to really be bothering them a lot for them to be willing to burn, an hour or two of their precious day off, with me to try and sort something out. So by and large, they're not going to reach out with something that's trivial. They're going to reach out with something that they feel is really impacting their life, or is impacting their performance on the field.
Last week, I was able to speak with an NCAA team physician. He said that the most desirable trait for a subspecialist that is taking care of their athletes is accessibility, being available to answer their call. And so that, what you said, goes along with that, being there for them on that day off, being able to get them in quick and provide them the care that they need.
Yeah, and I would say that's huge. And, not just for athletes, but just for practice in general. If you're, and obviously this isn't a practice management podcast, but I would say, one of the best ways that you can build your practice, be it, working with athletes or just in general, is to just be available. Because if your referring physicians know that when they pick up the phone and call, that you're going to, invite the patient into your clinic and deal with the problem, you're going to become their go-to at that point, because they know that if they get the patient into your hands, that you're going to fix the problem. Because at the end of the day, that's what the patient and that's what the referring physician care about is, are you going to be able to deal with the problem efficiently and effectively? And so I would say, yeah, being available is huge, as a practice builder, both as a sports ophthalmologist as well as just an ophthalmologist in general.
How do you balance your personal life with that aspect of being available?
So it can be a challenge at times. And, oftentimes when things do come up that need to be dealt with, it's kind of hey, we need help with this like right now. And so occasionally it does mean that you've got to, change plans and be a little bit flexible. Fortunately, on-field issues, we're already there, so we're already pretty dedicated. For the off-field issues, thankfully they don't come up all that often, but when they do, it's like, all right, we've got an issue, let's deal with this. To some extent, I would say for me, I sort of view it as, this is what I signed up for, which I get the benefit of, being able to work with these athletes. But, the downside is that sometimes you have to work with them at times that aren't as convenient. But, we work with them and we work with the trainers to get them in efficiently, and so that we can quickly determine what the issue is and how we can help.
Yeah, I think that part of that is having support system around you as well, having your family being understanding, they're bought in too, to this kind of path that you've chosen. Um, I was talking with someone who, they bring the whole family to the games, just because that's their kind of family culture, that's their personal culture, and so it doesn't add a whole lot to add on the medical responsibilities as well.
Yeah, absolutely. And I think, for me, I'm married, I have 3 kids, and so they all understand that, I'm basically, this is one of the things that Daddy does, and so they kind of understand that, that there are times when, I will get called away to deal with things. And that's true not just for the athletics, but also for being on call for the university practice as well, which the university practice gives me a lot more headaches in terms of problems to deal with than the sports aspect of things for the most part. Being on call for a level 1 trauma center at a university is there are very few things that can compare to that for ophthalmology in terms of the intensity of issues that you have to deal with at times.
Yeah, could you speak a little bit to just the field of traumatology within ophthalmology and kind of what that looks like and maybe how that relates to what we're talking about today?
Sure. So, one of I think the biggest challenges in dealing with eye trauma is that especially after hours on weekends and holidays, care isn't frequently available. And so there are very few hospitals now that have ophthalmologists on staff. And in my area, when I'm on call for the university, I'm kind of the de facto ophthalmology coverage for most of my state. And so, if a patient comes in with an eye problem that the physician or PA or nurse practitioner that's manning the ER doesn't feel comfortable dealing with, I'm frequently the one that they're talking to. And oftentimes these folks have very limited exposure to ophthalmology. And so, one of the biggest challenges there is just figuring out, you know, is this patient's problem severe enough that, you really need to send them, 7 hours across the state to see me for an exam. And that can be a really difficult call to make, especially over the phone. But I would say for the most part, in the interest of not missing things, if there's really any concern at all, we usually recommend, hey, go ahead and transfer them over so that we can take a look, make sure that everything's fine. And we'll have some where we think coming in, oh man, this is going to be a ruptured globe or really bad injury, and then they get here and it turns out that it's not that bad. And vice versa. We have other injuries where it's like, well, it doesn't seem this bad, but it's a red eye after trauma, so we really need to take a look at this. And then you find, yeah, they actually did have an occult ruptured globe, or they actually did have a bad facial fracture there that needed to be dealt with. And I would say the challenge that we deal with, there is pretty similar to working with the sports medicine physicians as well as the athletic trainers, because they just by design, they don't have a lot of ophthalmology experience. And so, we're basically sort of there to complement their capabilities is probably the best way I would say to look at it.
So is that sort of the trend within ophthalmology? There's the academic centers providing trauma care on call, and most of the people in private practice maybe don't want to take on call on the weekends. And so the majority of that trauma burden is placed on the large academic centers.
Yeah, and I wouldn't even say that it's so much that they don't want to provide that coverage. A lot of cases, they don't really have the ability to. So, for a private practice ophthalmologist, there isn't a whole lot of benefit in having hospital privileges for the most part, because most of our patients don't need to have surgery in a hospital or a
Hmm.
hospital setting. And so it's pretty common for, a lot of surgeons in the community to just have privileges in an ASC, and that ASC may only be open Monday through Thursday, 7 to 3:30 or something like that. And so if a patient comes in that has a ruptured globe, it's like, well, I don't have the ability to deal with this for another 3 days. And so in that case, we are sort of the stopgap in that situation. So, I wouldn't necessarily say that it's, that they don't want to provide that coverage. In some cases, they just don't have the ability to. And so in that situation, it just falls to the academic center to provide that needed care.
Thank you for clarifying that. That's helpful. What advice would you have for an ophthalmologist or trainee who wants to be involved as a team ophthalmologist taking care of athletes?
So I would say the first thing would be that you need to be an excellent ophthalmologist before you can be a team ophthalmologist. And so The knowledge and experience and skills are really key. You've got to be an excellent ophthalmologist because, as I mentioned before, oftentimes you're doing these exams and these evaluations under less than ideal conditions. You're not going to have a slit lamp. You're not going to have all the usual equipment. You're not going to have an OCT there. You're just basically doing essentially a bedside exam and, trying to make the determination of, can this athlete return to the game? Or, do we need to go to the hospital? Or, do we need some further workup here? And so, really working on honing those clinical skills, I would say, is key. For our coverage team, so I share the responsibility with two other ophthalmologists. So I'm a comprehensive ophthalmologist, so I cover most of the anterior segment issues. We also have a retina specialist with us who's able to cover the posterior segment issues. And then we have an oculoplastic specialist who is on the team as well. And so between the three of us, we've got pretty much most of ophthalmology covered in terms of the problems that the athletes are going to encounter either on or off the field. And so I would say, considering subspecialty training, particularly in retina or in oculoplastics, can also give you a little bit of a leg up if you're looking for one of these positions, although there's certainly a lot of anterior segment work to be done as well.
Yeah, I was gonna ask about that. It seems like comprehensive ophthalmologists manage most of the on-call or responding to athletes. I wasn't sure if there was a role for retina or for oculoplastics.
Yeah, there's definitely a role for them. And so, having them plugged in with our team, I think gives us additional depth. So that way, if an athlete does happen to get a fracture that needs a repair, well, hey, we've already got an oculoplastic specialist who's plugged into the system here. Or if a player happens to get like a vitreous hemorrhage or sclerotiria or something like that from a really, really terrible hit. We've already got a retina specialist who's on board, and basically, plugged in and ready to go. So, between the three of us, there isn't a whole lot that could come up that we wouldn't have the ability to deal with pretty quickly in terms of, injuries or, off-field issues.
Within the sport of football, how do you see ophthalmology playing a role in the future?
So, one of the things that I would say, I foresee, and is really a trend that's already starting, and I would say football is maybe a little bit behind the curve on this, but for hockey and baseball, they sort of realized very early on that vision is kind of a weapon. That vision is basically a way that you can give your athletes a competitive edge. And, when you're dealing with professional sports of any kind, you know, all of these players are really stupendous and profoundly skilled at what they do. And so, they've sort of joked that football is a game of inches. And, I've said before that, ophthalmology is a game of microns, that sometimes just giving somebody that tiny little edge where it's like, okay, we're gonna tweak your vision to that perfect 2010 to make sure that we're optimizing your stereo, that can give a player that edge that's going to enable them to make that big play, either that big catch or that big throw that's going to make the difference between a win and a loss in a really close game. And so I would say that that's, one of the things that I see going forward is that more and more of the teams are starting to recognize that, optimizing the vision can help to give their athletes that last little bit of a competitive edge, in addition to the strength and conditioning that they do, as well as the practices and getting in all the reps that they do. So, I would say that, I think teams are starting to recognize that this can be sort of a part of, crafting and conditioning a total athlete is making sure that their vision is optimized.
Thank you, Dr. White. Thank you for your time today. It's great to have you. And is there anything else that you'd like to add, just kind of speaking to medical students, ophthalmologists interested in getting involved with sports ophthalmology?
I would say, be ready to work with athletes at all stages, and just like we do with any of our patients, try to get to know them and try to get to know what their needs are, and recognize that the needs of all athletes are not necessarily going to be the same depending on what they're doing. And I would say one of the other populations that I work with a fair amount in my work is law enforcement officers, and also people who are involved in shooting sports. So I have a lot of patients that are involved in those. And as a for instance, patients who are doing like say shotgun sports, so like trap and skeet, their visual needs are going to be a lot different than somebody who's say hunting, or somebody that's involved in handgun sports. And so, I know a lot of my residents that I work with when we're doing like say a cataract evaluation, they'll say, "Oh yeah, this guy's a hunter." It's like, okay, so let's talk about what is he hunting? What type of a setup is he using? Is he using a scope? Is he using iron sights? Because that's going to affect for like say a cataract patient where you're going to want to target their vision for. And so that would be, another example sort of within the sports arena of, being able to customize the experience for your patient.
Yeah, in medical school, we talk about individualizing the care that you're giving, and that's really a lot of what sports ophthalmology is about, is getting to know the patient's needs and helping them live life how they would like to.
Yeah, absolutely. And that's one of the things that I love about sports ophthalmology is just that we do have that ability to customize the experience for our patients, for our athletes.
Last question before we go. What is your favorite sport?
So I'm going to have to give you three answers here. So
All right.
my favorite sport to play, if you consider this a sport, which I do, is fishing. It's the only sport that I've ever really been good at, but I do really enjoy that. My favorite sport to watch live is hockey. I absolutely love watching hockey and just seeing an athlete move that quickly on skates alone is just amazing to me, the coordination that takes. And then to add into that now they're moving at that speed on skates and controlling a puck at the same time is just, it's incredible to me to watch that. I'm just in awe every time I get to see that. But my favorite sport to watch on television is definitely football, though. I really, really enjoy football. Enjoy following the Chiefs that are my hometown team. And I did my intern year actually in Pittsburgh, Pennsylvania, which that's how I discovered hockey. And so I'm a little bit of a Pittsburgh Penguins fan, and I'll also cheer for the Steelers when they're not playing against the Chiefs.
Nice. Yeah, I was gonna ask your favorite sports team, so you plugged them in there. That's great. Thanks for your time, Dr. White.
All right. Thank you so much. I appreciate the invitation.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.